Welcome to Hull Royal Infirmary. We do operate a no smoking policy, and that includes the buildings and the grounds. However, if you are admitted to the hospital as a patient or you are visiting as a relative, you may be able to access information to help you quit smoking. Probably for patients, it's an ideal time or opportunity for them actually to gain advice and support regarding a no smoking attempt. While patients are in hospital, they can actually obtain nicotine replacement therapy, which is free, and one of the specialists will come and see them to have a chat with them about the most appropriate nicotine replacement therapy.
Smoking by far is the largest cause of blockage of arteries to either the legs or the brain, and is one of the causes of stroke.
We offer help and support to any patient who is in the hospital and they might need help to deal with their cravings while they're actually in the hospital, or they may want to stop smoking and just don't know how to go about it, so we can obviously help and advise them. And they also may want to have follow-up support when they actually go home and are discharged from the hospital.
I had to come into the hospital to have a hysterectomy. And with any operation, you're advised to stop smoking, which I joined the cessation clinics and stopped smoking for the operation. I had the operation that didn't go very well, so afterwards I was struggling and I did relapse, started smoking again. I thought, what am I doing? I don't want to do this. I have stopped, so rang the clinic back up again to see if I could get back on Wendy's clinic, because she's absolutely fantastic. And she took me back on her clinic and made a date to stop smoking. For every day that I stopped smoking, put a 1 on my calendar, circled it, double that as I did it in 1 week, 2 weeks, 3 weeks, and I did that for 352 days till I got to my year.
If you ask the nurse or the doctor in charge of your care to refer you to one of our specialists while you're a patient on the ward, one of our specialists will visit you within 24 hours and tell you about the sorts of nicotine replacement therapy or the support and advice that's available. You'll be started on the nicotine replacement therapy while in hospital, and then following discharge we'll ensure that you are discharged home with some nicotine replacement therapy, and we will continue to have contact with you either by the telephone, or we can refer you to one of our stop smoking groups or one-to-one walk-in centres within the whole area.
It's in their own best interest to stop smoking, because if they don't stop smoking, even if we offer them an operation, they don't get the benefits that they're supposed to get from the operation. So in effect, what they are doing is they are robbing themselves of the benefit of the operation that we're offering them.
We're not here to stop people smoking. None of us can do that. We're here to help and advise and support. And I think that's probably the main message I would like to get across.
Do you know, my friend stopped a long time ago, and she used to say, if I can do it, you can do it. And I couldn't do it, and it was like, but I can't, and I wish that I could. And I've done it now a year, and it's like, it can be done. It can be done, and I'm here now, nowhere will I go back.
In the folder at the end of your bed, there's a patient information document where you can actually obtain our telephone numbers and self-refer into the service. If at the time while you're in hospital you do not feel ready to quit, but following discharge change your mind, you can still contact us and we'll arrange some support out in the community.